Madam Chair, members of the committee. I'm here to ask for your support for the PCS, which will prohibit public health facilities and state funds for being used for gender transitions and surgery on minors. This is a common sense bill that seeks to prevent these unproven treatments on minors. The bill is not an attempt to limit treatment for children suffering from gender dysphoria or those struggling to form their identity. Rather, it seeks to limit children from potentially life-altering treatments before they are truly able to understand and consent to these interventions. We know that children with these disorders suffer a high rate of mental illness and suicidal tendencies. Many children are calling out for help and treatment, and it is right and noble that we offer help and try to relieve suffering. But we must not jump to unproven remedies for these children. One of the mottos for medicine is to do no harm. And although there is a strong desire to try to anything to help them out, we must consider especially these treatments that are permanent and they can lead to permanent harm. Puberty with the associated hormonal changes not only affects the development of sex characteristics, but also the brain, muscle mass, bone growth, and many others. Interfering in this process has many unknown risks. State agencies should offer robust mental health and psychological support for these children, not advocating for surgery. I know of no definitive evidence that these interventions, and I don't like to call them treatments, these interventions are beneficial in the long term, and certainly not for children. Surgery and hormone therapy does not reduce suicides, and it has limited data that it actually helps psychological well-being in adults, and there's no convincing data for children. We know that across Europe, which is about a decade ahead of us in terms of gender treatment and hormones, has eliminated or severely limited these treatments in the recent months. When new medical interventions are undergoing research, children are most often excluded because we have special protections for the most vulnerable among us. It would be critical to understand the effects and long-term implications on adults before we start treating children. We know that a vast majority of children with gender dysphoria, the condition is transient and self-limited. That's why limiting interventions on children is most important. Much of the existing data supporting these interventions are really case studies. In a case study, it uses a small number of research subjects, so it really makes it hard to determine if the interventions are effective, and it can't identify the associated risks of the therapy. There are not the kind of long-term robust studies that really support interventions on minors. This PCS is narrowly defined to limit those interventions in state-owned, affiliated, and institutions and prohibits the use of state funds for them. It's wrong to use the resources of the state to enable unproven interventions to be done on children. We know that there are medical conditions for which hormones are completely appropriate and indicated. This PCS does not prohibit the medical treatment. This language allows treatment that are indicated for valid physiologic conditions, just not gender transitioning. Gender reassignment surgeries are very complex procedures, and we know that some of these patients who undergo surgery will have complications. The bill does not prevent surgeries that are needed to deal with the complications, nor does it prohibit surgery for physiologic conditions. In Section 2, just briefly, there's a federal court order that prohibits the use of the state health plan to cover this. If that lawsuit was upheld, then that would affect that, and that's what Section 2 is about. I ask you to support this PCS, and I will stand for questions.
Sorry, Representative Brockman.
Yes, thank you, Madam Chair. I have a family member who, I don't want to get too personal with this, has called me many times and we've discussed this very issue with their son, and they really struggled with this, and they called my phone and they cried, and they're really against wanting to have this procedure done, and their son wanted to have the procedure done. And we also have members like Representative Autry, who's very accepting of this type of procedure if it was for their her granddaughter. And I guess my question is, why are we standing in the way of parents making this decision for their children?
Representative Rader.
I'm not sure I follow your question.
I guess
Representative Brockman.
your bill is outlawing it, and I guess if a parent is willing to have the procedure done, like Representative Autry, why would we stand in the way of the parent making that decision?
So this bill doesn't,
Reader.
I'm sorry, thank you, ma'am. This one does not ban it. This just says state facilities, and you can't use state funds for these treatments. So that's what this PCS is about.
But if you're using the
Representative
public
Brockman.
health department, then wouldn't that affect? I guess I'm not really sure how to vocalize it, but I guess it seems like if we're outlawing it with state funds, then it's you're outlawing it, and I think that's the issue here. Why are we outlawing it in the first place if a parent wants to make this decision?
Representative Reader.
Again, this doesn't outlaw it. This says you can't use state funds that are limited for this procedure because the medical evidence is not compelling on, and this is again for minors. So this is focused just on minors. The evidence is not compelling that this is a successful treatment, and we ought to allow fully informed patients to make these decisions that can have permanent, lasting effects.
And I guess that's kind of my point is if the parents would like to, sorry, if the parents would like to have the procedure done, and then you're making it harder for them to have the procedure done, then you kind of are outlawing it, aren't you? If the parents want to have this procedure done, you're making it harder for them to have it done. Isn't that what you're saying the bill does?
Representative Reader.
I think I've said it's not outlawing it.
Representative Serrani.
Thank you, Chair. May I ask the bill sponsor a question?
Representative Reader.
And this is to support what my colleague is saying. So having it not funded by state funds makes a stratification of class. So healthcare should not be classist and only be able to be afforded by only certain people. But I'm going to, to springboard off my colleague's question, we often hear in the Senate and the House that it's important to understand that people who decide what's good for their children are their parents. The parents and the families can decide what's best for their child based on their child's individual needs. And the parents are the ones that really understand what pathway is best for their children. And this gives those parents and those families the freedom to choose for themselves. So help me understand, what's the differentiating factor of school choice versus healthcare choice of their child, be it whatever, state funding, private funding, this is healthcare. Help me understand the difference of parental choice in their child's needs, be it school, education, or healthcare.
Representative Reader, and I'm going to say from now on we can only have one question per member because we are on a time-sensitive schedule and we have two other bills.
So I think the answer to the question is when you're choosing your school, it's not a permanent intervention that surgery might be. And to implement a permanent intervention on a child when we don't know the long-term implications of that. There really is not long-term data on the effects of puberty blockers and surgeries on children. And so that's why I would say that's what's different about this, is that these procedures are permanent. And when you have someone in North Carolina, you can't get a tattoo under 18, even with parental consent. I looked it up. I was shocked at that. So why would we allow something as permanent as this? And the parents do have a role. They do know their children best. What this bill says is that under 18, for minors, we're going to not allow these to be done in state institutions.
Representative Tyson.
I'd like to ask the bill sponsor a question.
Representative Reader.
Representative Reader, if you're a parent and you have your minor child with you and you go into a restaurant and you'd like your child to buy a beer or get a mixed drink, do you think that's allowed?
I'm not a lawyer. I went to medical school. I'm sorry, but I don't believe that the restaurant would allow you to buy an alcoholic beverage for your child.
If you go in a follow-up. If you go in a grocery store with your minor child and your child wants to buy a pack of cigarettes and you don't have a problem with it, is that allowed?
Representative Reader.
Again, I do not believe that that's allowed under the law.
Thank you, Representative.
Are there other questions? Representative Cunningham.
Thank you, Madam Chair. Representative Reader, for hermaphrodites, children or infants that are born with both organs, female and male, the parent gets to choose. Is there a carve-out, because public dollars are used in that space, if the patient is a Medicaid recipient and the baby is born under Medicaid? Is it a carve-out in there for that?
Yes, if you look on page 3, when under line 4, section 1, if you have a physiologic condition, congenital adrenal hyperplasia is the most common, there's a hormone deficiency, that is allowed under this. So if you have a medical condition, a biologic, hormonal disorder, you can still get treatment under this bill.
Representative Crawford.
Thank you, Madam Chair. Just a question for the bill sponsor.
Go ahead.
Thank you. So under the 143C 6-5.6, lines 29 through 35 or 40, I guess, in here, for anybody who is currently undergoing hormone therapy or taking puberty blocking drugs, who may be impacted by this new section of the law, what are we going to do with those individuals who may be undergoing treatment right now? Is it the provision that we're just going to stop letting them do treatment right now, or is there a continuation, a carve out of sorts?
Representative Reader.
What this bill would do, they would have to transition to a non-state facility. Again, this is limited for state facilities and state funds.
May I ask a follow-up?
A follow-up, please.
Thank you. Thank you, Madam Chair. So for individuals for whom it would be a barrier to continue treatment, let's say there's transportation issues, there's coverage issues, there are all kinds of things that could be a barrier to treatment. Is there any kind of waiver that we could consider for those individuals so that they could continue treatment?
Representative Reader.
I think if that was an issue, we could think about a way with which to help those patients continue their medical care. The concern, though, again, there's not good data that this is an effective treatment. And so I think in minors, we would have to question how that's done.
I'm going to call questioning right now. We do have 2 people that would like to speak from the audience, 1 pro and 1 against. Ronan Bilodine, I hope I got your name kind of right. If you would approach the mic, and we will allow 1.5 minutes. We don't have very much time left.
Hello, my name is Rowan Billadu. I'm 15 years old. I'm the brother of 3 amazing people. I used to play club volleyball. I'm a military child, and I'm a sophomore in high school. I also happen to be transgender. I should be out enjoying my teenage years, but instead I am speaking to my representatives, asking them to fight for my right to live. As a transgender person, I've experienced a lot of difficult things. I've been bullied by my peers in many ways. People will call me slurs, tell me I should kill myself, post horrible things about me on social media, yell at me in the bathroom, and threaten to hurt me. I've lost family, including my own father, after standing up after years of maltreatment when my identity became an outlet for him to just abuse me more. I was fortunate to have a mom who accepts me and a stepdad who became my new father. Because of them and their support, I was able to start taking testosterone, according to medically proven WPATH international standards, supported by many studies, including a 40-year long-term outcome study published in 2022. However, a lot of transgender people my age do not have that kind of family support, and with the bills being proposed all over the country, now they don't even have the support of their own government. It is not fair for our rights to be taken away because our lives are being taken away. Transgender teens are 7.6 times more likely to commit suicide than cisgender teens. In 2020, I was almost part of that statistic. It was only through the support of my family that I was able to get through it, but others do not have that support. In 2022, 1 in 5 transgender youth attempted suicide compared to 1 in 10 cisgender youth. However, a study from American Academy of Pediatrics found a 73% decrease in suicidality among transgender youth who had access to gender-affirming care. My access to gender-affirming care saved my life. I want others to have that same opportunity. I am tired of seeing my brothers and sisters die because they are being denied their rights.
Order, please. Our next speaker is Prisha Mosley. Ms. Mosley, you'll have 1.5 minutes at the mic. Please identify yourself.
My name is Prisha Mosley. I'm a woman who has suffered severe and lasting injuries caused by so-called gender-affirming care as a minor in North Carolina. This care included the medical invention to make my body appear as that of a male. As a teenager, I suffered from a number of mental health issues, which you have heard about, including OCD, borderline personality disorder, anxiety, and depression. I also suffered trauma from sexual assault, and I engaged in self-harm. At 17, after meeting with me for a matter of minutes, a counselor told me that I was actually a boy and that changing my body to be more like a boy's would fix my mental health issues. Around the same time, a doctor prescribed me testosterone. While I was still 17, a surgeon familiar with breast reduction surgery for women met with me and expressed eagerness in performing a gender-affirming top surgery on me. At 18, my healthy breasts were cut off and incinerated. As a result of these healthcare providers' actions, I have suffered severe and lasting injuries. These injuries are both psychological and physical in nature. My body did not develop the way it should have and does not function normally. I'm unable to nurse a child, and I don't know if I will be able to conceive. I suffer pain and irreversible changes to my genitals. My voice has been permanently damaged. My larynx, crushed by the overgrowth in my throat caused by testosterone, prevents me from singing and even raising my voice. Even speaking for long periods hurts. My body aches every day. I suffer daily with phantom breast syndrome, a waking nightmare in which I am haunted by the ghosts of missing body parts. I suffer from chronic pain and a host of additional medical issues and psychological and emotional anguish as a result of
Thank you. Representative Shepherd, you're recognized for a motion.
Thank you, Mr. Chair. I make a motion for a favorable report for the PCS for Senate Bill 631 and a favorable referral to rules. Thank you.
Representative Shepherd moves for a favorable report to the PCS for Senate Bill 631 and favorable to the original bill with the serial referral to House rules. All in favor, say aye. Aye. All opposed, no. The ayes have it, and the motion is approved.